Comfortable? Everyone's
Yeah, I'm comfy.
Amazing. As we're talking about the brain, about the heart, the brain. Thank you so much for joining us, Claudia, today. I really appreciate it. This is an episode that's had me thinking the past week. What questions can I come up with? What ideas? And obviously we're joined by Boris today. So if you want to tell us a bit about yourself, Boris, and then we'll move down to Claudia.
So basically, I'm Boris. I work as an osteopath, and I'm also an academic at a university where I teach into the osteopathy program. My area of expertise, I guess, is biomechanics and exercise rehab. So that's predominantly where I spend most of my teaching time. But I'm really excited to speak to Claudia because I really love the interconnection between anatomy and the real world applications, particularly in my field, like osteopathy, and then seeing that clinical transition from just the theoretical components of anatomy.
Exciting. Claudia?
Me, okay. Well, my name's Claudia. I have been teaching for, and this is giving away my age, unfortunately, for 35 years at 6 Australian universities. I currently work at an Australian university where I teach anatomy. However, I have a kind of an unusual situation in that my teaching is all online. So in my 35 years, I've always taught in an anatomy lab with cadavers, which I think are probably the most important resource that we can offer our students, but I now teach everything online. So it's been totally different, and I've learned a lot, and I've actually got it working really well. So, and I started out as a scientist. So I'm an anatomist, but I did a PhD in medicine. So I used to study cells in the eye.
Wow.
And then I was in a laboratory doing science, and then one day I discovered when I was teaching, I thought, oh, I'm a good teacher. So I got into that, and now I do all education research. So all my stuff is on education now.
Wow. I want to talk about obviously everything being online. What are the cons of that these days, for students?
Well, to me, the con is that they don't get the face-to-face with you, but that's not a con to the students. They love it. They love that they love that they can be at home, watch your lectures when they feel like it. They can be in bed. It's more convenient for students. Yeah, but for us, I think, I miss standing in front of a lecture theatre of 300 students. I taught 600 students in Newcastle, standing in front of and getting that vibe. We don't get that anymore. To me, that's a disadvantage, but it's the way things are going. More and more universities, and I've just learned that, are doing more online.
Oh, absolutely. And so with that, do you find that when you are teaching in front of students, do you find that their engagement is not as great as it used to be because most of it's online now?
Yeah, I think so. I'm pretty good at getting them engaged, but definitely. I mean, they're different. And even when I teach online, you've got people on the screen. Some of them have their cameras off, so that makes it a lot harder. Yeah. And I appreciate people do it for different reasons, but, even online, I try to get an engagement with them. And to me, that means looking at their eyes, looking at their faces, pulling faces. But that is harder. It's harder.
Online's also harder because you can't tell if they're cheating or not. But, their exams.
Well, for exams and things, definitely.
Wow. So
AI has changed the world.
So they're pretty much gone on the radar without being caught. Can you tell pretty quickly if they're cheating?
Not in a written exam. No, you can't. And that's what I was saying. We need to get in there day one and start talking to them and teaching them academic integrity. They need to understand that they're here to learn. When they're standing in front of a patient in 5 years, it's no good if you've cheated your way through. You won't know anything. You need to be a good professional. So, if you can try and get that message across early on, the good students will hear and understand. But we have heard that the stats on students cheating are very high.
Yeah. Do you think the students are there for the wrong reasons? And so they're just trying to coast through university thinking that...
Definitely sometimes. I don't think all students are teaching who have the vocation for what they're doing.
Yeah, that's very true.
Yeah, some of them have been pushed into it by their parents or whatever. Or some of them, I used to hear this, and I won't say what profession it was, talking about, we're going to be doctors, we're going to make lots of money. I'm like, you're not there for the right reason, so it does vary.
Yeah, and so this is one thing I'm really, really interested in, because you said you started off as a scientist and then you transitioned to being a lecturer and academic. What was that transition like? Like, as in, what steps did you need to go through to
I was
get to the
actually
level
I was
where
actually
you
both
need
at
to
the
go?
same time. I was a lecturer and scientist at the same time. So when I started lecturing, I was doing lab science. So I'd go and do stuff in the lab.
Yeah.
It was only down the track that I discovered that I was a pretty good teacher. So I thought, okay, I'm going to change my research, and rather than doing lab research, I'll actually do education research, which is actually not going to get me as far. You don't go as far.
And is most of that academic research in the context of anatomy and physiology and how students learn?
Yep, that's, to me, it's all about how they learn is what I do.
Has much, in your 35 years of experience, has much sort of changed in terms of the learning and the way you apply, like the pedagogy, as we sort of talk about in academic circles?
I'd say yes and no. I've been trying to change everybody I meet, but it's very hard because sometimes you can't teach an old dog new tricks. And I have found, and it's not actually relative to age. I mean, I say that, but it's not. Some people just don't want to change what they've been doing for years, and they won't try something new. Whereas I'm telling them, as a teacher, we should be evolving. We should be always learning new things, doing new things. But not everyone thinks that way. So I've found that my biggest roadblocks have always been colleagues, not students.
Yeah, that makes sense. That makes
colleagues.
sense. I've
People don't want somebody around who's changing everything.
Well,
that's stirring up the pot.
That's true. That's true. I think we can definitely relate a lot because I do try and change up a lot of structure.
I do it all the time,
but it's not obviously accepted very well.
I find that when I go to conferences, my biggest people who love what I do the most are people from other countries. So the Americans love what I do, other people, other countries, Belgium, but Australians,
Why do you think that is? Why do you think that is? Are we just like
I think people feel threatened, and I try to tell them everything I do isn't about threatening anybody or damaging. It's about helping students. That's all it is. It's the bottom line is helping them, doing the best thing for them, but it's just getting out of people's...
So out of all the changes, what do you reckon is the best way, or what's been so effective in terms of teaching them anatomy specifically?
For me, it's using innovative approaches. So I always thought, and yes, I used to teach in a lab, the cadaver is always the most important thing, but when my students come into the lab, I'm not just giving them the cadavers, I'm giving them a bunch of other stuff to do. And I often had people walk into my class and go, oh my God, it looks like a bloody childcare centre in here. I'm like, good. So I get my students to draw. If they're good at drawing, draw things. And you would have seen in the stuff I sent you, there's lots of beautiful drawings.
If you want to open up on YouTube.
Beautiful drawings. I've got the body painting, so they learn surface anatomy. Most of these students are going to work with real life patients. So they need to be able to find anatomy on living people. Doing it on a dead body is not good enough. They need to do it.
First one.
And I think you're absolutely right. And I think what happens is students get that disconnect, and then they're in practice in the clinical sense, and they still don't know what they're doing.
It's probably the better one. No, go down to... No, not that one.
Not that one?
No.
Go back.
Anatomical Man. Can you find Anatomical Man? Look up Claudia Diaz, Anatomical Man. Yeah. That's probably the better one.
Yeah, because it's quite interesting, all the paintings. And
one of them's a time-lapse and one of them's an interview, so probably the time-lapse,
This one?
Yeah, that's a good one.
Oh.
And that's what we do. But even getting them to build things out of Play-Doh, getting them to do actions. When I teach the abdominal muscles, do you know what I do in a lecture theatre? I bring in hula hoops. And I did once, I hula hooped for a whole hour while I was lecturing. But I get them to come down and do it because... Actually feel it, actually do things. It's doing. You learn by doing.
You're right.
So it's using all your senses, using everything, and that's just a time lapse of
how long did that one take? 24 hours?
24 hours.
Wow.
That was done here in Melbourne, actually. So that was Zach. Zach O'Brien was a chiropractic student who then went on to play for the Brisbane Lions. Yeah, he did.
So he knew all the muscles and everything.
It was really cool because apparently at his first game at the Gabba, he got his first goal, and I didn't watch it, which I regret. Apparently up on all the screens, they put up pictures of him as Anatomical Man, which I thought was very cool.
It's very interesting.
That's all students. It's all student projects. The artists, the models, the photographer, everyone was students.
And they're pretty much learning.
And they're learning, and they're learning in an interesting, fun way. I mean, if you can get students to enjoy learning, then they put more effort in and they do better. It's a win-win for everybody. So to me, it's very simple. And, I make it fun. In my lectures, I have competitions. When I used to lecture in a lecture theatre, I would have singing competitions.
Wow.
Okay, we're not here to learn anatomy, but some of you like singing, sing. And I'd give them a little skeleton as a prize, just reminding them that we're all still humans, we've all got talents, and just getting them to enjoy it. So I think that's a really big thing. And anatomy is a hard subject, and this is why students will tend to try to memorise, and that's what we call superficial learning. They learn it and then they forget it. And I say, no, we're not. And I say to them, they don't believe me. I say, when I get there, I say, I'm not here to teach you anatomy. I'm here to teach you how to learn anatomy. That's what I'm going to teach you.
Wow. So
it's about deep learning. You don't want, and I say, no more memorising from now on. You're going to do it differently. And they do learn and they do appreciate it.
And that's transferable to all other
100%.
disciplines and other aspects of science.
I've gone and done workshops for microbiologists where I've taught them how to build little microbes and things out of Play-Doh, like anything. It's the way you think. It's thinking differently.
Where do you get these ideas from? Because that's very inspiring, I have to admit, as an academic and a lecturer. It is very different to apply
It's very
that sort of
different.
learning.
I know. I don't know. I get the ideas from people. Like I've had students who have put ideas in my head. The first anatomical man was in Queensland, and basically one of my students said, I've got a friend, he's Norwegian, he'd really love to be a model for you. And I'm like, okay. And that was my first anatomical man. I do find the Europeans best models you can ever have. Happy to get down to a G-string, no problems. Aussies, a lot less willing. So, yeah.
Yeah, I can attest to that.
It's just I think getting them to have fun is really, really important because it is a hard subject. So you get them to do it differently. And if they do it differently, then they do deep learning, not superficial learning. No more rote learning. So I don't let them rote learn in my classes.
Do you find that's really hard to get away from that rote learning
100%.
when you're online?
I don't know if it's any harder. No, not really. The problem is we've taught them to do this at school.
Yeah.
Kids are taught to rote learn in high school. So they get there and they think they can just memorise everything. I don't think it is harder online. I mean, it's taken me a few years to get it working online, but, when I make a good connect with the students online, they're very, very good. And I also give them oral examinations. I don't just give a written. So the oral examination, they can't cheat.
I would absolutely see. This is the thing. I would love to change all my courses
I have to.
like a Viva style
100%.
oral examination. However, though, it's very restrictive, budgetary wise, and staffing and resources wise.
It takes time.
It does. It annoys me so much because I know that some students will definitely fail courses, but because they rote learn, don't use any critical thinking and use AI to cheat, they just get coast through and then they graduate and they don't know anything.
The only consolation of that is that when they do graduate, they're going to be really bad at what they do.
Yeah, but
they're not going to be good.
No, this is true. And I guess anatomy, like especially for osteopathy, what we do, and that is one of the reasons why I got into osteo, is like I just love the human body and the anatomy side of things. That whole transition between understanding anatomy really well and then being able to apply it clinically.
That's what's important.
That doesn't happen when you rote learn anything.
No, and even the old anatomists, I know a lot of them would just teach anatomy in the lab with the cadavers. And I'm like, no, I put a lot of emphasis on surface anatomy. It doesn't matter how much you learn in a book or on a cadaver. You need to see this on a living person. You're going to be dealing with a patient, not a dead person, unless you're me. So, do you know what I mean? So they have to learn that, and that's where they correlate. And look, when I was in Queensland, it was beautiful because we'd get the students to body paint, for example, hearts, and then they would move down to the clinical skills area with the doctors, where they would then learn to use a stethoscope and stuff. So it correlated really well.
Oh, absolutely,
but we should be doing more of that.
And the anatomy, and this is one thing I find really challenging to teach students, is they learn two-dimensional. The human body's three-dimensional, so when you're in a different body position, you're palpating the same structure. It just feels different, and it might be in a slightly different position.
And they have to learn. And my students always giggle at me because I always say to them, look, I'm the one lecturer who's always going to encourage you to touch yourselves. Touch yourselves a lot, okay? That's really good. It is. I mean, you need to
giggle, actually. Just think about
you get to an exam, literally an anatomy exam, and you could actually sit there doing this.
Oh, that's how I remember the hamstrings. Where's the semimembranosus? Where's the semimembranosus?
You know what I mean? That's how they should be learning it. So if I see a student doing that, then I think they're doing the right thing.
That's crazy. You did neuroscience as well, yeah?
I'm a neuroscientist. That's where I did my PhD,
I've got a question. My question is, there's a myth out there that everyone says we use 10% of our brain. How true is that? Is that real or?
Well, I don't.
It's like a myth. Everyone uses it. Like,
I know, people say that.
But like...
I don't know if that's correct, the actual...
I probably don't even use 10% of my brain.
But I think I was going to say a lot of people I know use much less than 10%, and I'm not looking over there. Just joking. But no, I don't know if it's actually correct, but I think the idea is that we're not using all of our brains all the time. But then even when you study the brain's amazing, because you look at the brain, and I show my students, some people have a bigger part developed on this side than that side. So some people are more mathematical, some people are more musical.
Is that real?
Yeah, that's real.
What?
Yeah, there's parts of your brain which like
That's
are more
bigger than the other.
Or not bigger, but more developed. So,
Wow.
People really are more. So they talk about being left-sided or right-sided brain. You can be more artistic, more mathematical, more, and that's real, and that's amazing.
I'm definitely on the low IQ side. So
Well,
No, I'm sure that's not true.
I'm sure you're not true.
that's I'm not too well with, but that's incredible. I never knew that.
No, the brain's amazing. Yeah.
How powerful is the brain? Like when we look at it and
It's
think
a-
of it, like how powerful. Like
It's everything.
do you reckon we're at a level where we know the complete understanding of the brain,
No.
or not yet?
No.
Really?
Not even close. No.
Wow.
No, they're still working on it. I mean, there's so many things we need to know about different diseases, conditions. We don't know. Definitely don't know.
That's
everything.
crazy.
No, there's so much.
Even with all the technology.
No, the technology. We need people. We need scientists. We need students studying science.
That's crazy.
And I don't know stats. There's probably not as many as we want.
No, there's not.
Do you know what I mean? Yeah.
Definitely don't think there's enough students transitioning from doing, career-based work, such as being a nurse or an osteopath or a chiro or physio or whatever, to going then into research to sort of discover and develop the latest stuff.
That's what we need. We need more
David,
people
can we
doing
see
that.
how much we've discovered of the brain? How much percent?
How much Google is there?
Oh, let's see.
I don't know if I trust Google, but you could ask.
Yeah.
That's crazy. I thought we'd have like pretty close understanding of it.
No,
discoveries.
areas we know about, but no, there's heaps we don't know. I mean, think about all the conditions out there, all the neurodivergent conditions, autism, all that. We don't know a lot about these things.
Recently, there's a family member of mine that's got a
heaps.
very special sickness, and they finally came out with a name for it. And there's only 4 people in the entire universe
Really?
that have this condition. Yeah, it was some long syndrome name, like.
Wow.
And I was like, 4 people, and they're like, yep, 4
I
people.
like how you said 4 people in the entire universe.
The
You meant Earth,
universe.
didn't you? I was very.
Yeah.
I noticed that.
In the universe.
In the universe, you mean in
Do
the
you remember
world.
what it's called?
Nah, it was
No,
like
but there are.
no change. It was like
And
the
then
name of this long.
conditions like that, you're going to get fewer people studying them because they're not so common.
Yeah,
There's
no one's going to
some
recruit
top
that.
Even the common ones like cancer. And did you find something?
Yeah, here's some new studies offer unexpected insights into the brain. So, one is air pollution may trigger memory loss by disrupting brain proteins. So that's something that we've
Interesting.
recently discovered.
Wow.
How pollution affects
Well,
our
something
brains.
I was taught years ago, and it never got out to the public, which annoyed me because I talked to the researcher who did it, is that smoking can cause males to not be fertile, to lose their fertility.
Wow.
And the worst part about this was that it actually showed that a man, so you always say pregnant women shouldn't smoke. But what I was taught by this guy is the men are the ones who shouldn't smoke, because a man who smokes passes on damaged DNA to his children, and then it's in the line forever. It never disappears.
Wow.
So that to me was really powerful. And I thought, why have they got these silly pictures of rotting lungs on the cigarette packets? Maybe you should have something different on there. But no, the stuff
How
about
much
the
does that
brain's
affect it
amazing.
by a big margin?
Yeah, it's a bit. So.
That's crazy.
So often, I had a cousin years ago who died of testicular cancer. He was only 22. His dad was a chain smoker.
Wow. It does.
I'm not saying
Transcend.
that's... It often has... There's all these things that... there's so much we don't know about,
The
especially
people
the
out
brain.
there, don't bloody smoke.
This one's interesting
Smoking's
about
bad.
left and right wing can't say it?
Yeah.
Linked to different brain structures. Yeah, so
Yeah.
even politically, how your
100%.
brain is structured
Yeah.
make you more right wing or left wing.
100%.
It's been crazy, isn't it?
100%.
Yeah. Look at that.
That's incredible.
Blame your brain.
Wow.
Yeah, no.
information.
No, the brain's amazing. No, there's so much we need to know about the brain.
So one question. So from all those sports people out there that are getting concussion, what is the rate of recovery? Like, is there a point that you can do manual therapy to be able to change up the structure of the brain or help it heal? My opinion is no.
I don't think so.
Yeah, that's what I was
don't
thinking.
I don't think so. I think I mean, it depends on what kind of concussion or what kind of damage the brain has, but there's a lot of damage that can't be recovered. Like there are cells in the body that can recover them, but others can't.
Like say example,
Nerves
boxing. How dangerous is boxing for the brain? I box myself, so I need to know this.
Anything where you're hitting the head
Wow.
can affect the brain. Yeah.
So, is it in your? Do you think that we should then ban most sports where there's head collision with other people or items or objects?
Yes, but they're not going to. That's not going to happen. It's not going to
yeah,
happen.
never happen.
Humans
Makes too much money.
humans love hitting each other. They love hitting
This is
things.
true.
Do you know what I mean? Like it's not going to. All you can do is try and look after people and try and educate them to look after. I mean, the Americans, don't they wear those big helmets and stuff when they're playing? We don't do that because we think they're wusses, but. Maybe they're doing the right thing by wearing
And they still get concussions.
Oh, they get a lot of concussions in the NFL because it's very short, sharp,
That's
just
what I'm saying.
hits. You know, that's the sport.
But then the Americans, I'm not sure if I'm right with this, they don't wear helmets when they're riding motorbikes. They don't legally have to wear them, whereas we do. So
depending on the state, I think. But
yeah. So do you know what I mean? There's
That's
so
a
many
bit
things
reckless.
where we don't look after our heads. Your head's pretty delicate. Your brain does. Your brain. You wouldn't be here if it wasn't for your brain.
Oh, that's why I started to slow down on boxing, to be honest, and fighting and sparring, because I'm like, I need my brain. I don't want
Just
to be
tell
stupid.
them they can hit you from here down.
But then we get damaged organs, and then we become, we've got pains different. Like,
But where do you draw the line with sports as well? In the UK with soccer, I mean, now they're talking about removing the, heading the ball.
I've heard
So
that.
because how they consistently head the ball, and that can also cause over time, a lot of brain damage. And with lots of sports, it can, even in AFL, they were talking about banning the specky, and you jump up on the shoulder or your leg because you end up hitting them in the head or the back of their head with your knee. Again, another danger, right? But where do you draw the line? How much do you have to change the sport? Boxing, it's about punching each other in the head.
Yeah,
You can't change that,
it's
Yeah, I wouldn't do it.
I've boxed my whole life, and then when I realised, I started to look into the damage of it, I'm like, I need to stop. I don't want to be retarded by the age of 40.
Find another hobby.
Yeah, I think we're going to get into golf, maybe.
Golf.
Sounds.
We're getting a bit old, so we've got to get into the classic golf and kind of relax a little bit. True, Diego?
Like Happy Gilmore.
Well, no, I'd say if you've watched Happy Gilmore 2, his wife dies with a golf ball. He kills her with a golf ball. Sorry.
The first 5 minutes,
Spoiler
alert.
Sorry, but yeah, so golf is no.
Talking in
no sports.
No sports. We're gonna get over the sports eventually. Talking about the brain, there's something that's always fascinated me. When we sleep and we start to dreams, where did these dreams come from? It fascinates me.
I'm fascinated by it too because I have stupid dreams some nights. I go, why did I dream that?
And then we have ones that we remember and ones that we don't
I know.
remember.
I think things that happen in your day just spark little dumb dreams that I like. For me, at least, that I have. But I don't think there's an explanation for things like dreams.
don't look at me.
I've looked
memories
everywhere.
as well. Your memories.
And
everything
if you're
is
really
subconscious.
stressed, you can have worse dreams. So it does affect you.
Because I've looked everywhere. I can't find one answer or
No.
anyone that's explained where dreams actually
No,
come
well,
from.
I had a dream the other night, and I probably shouldn't say this here, where I was talking to Chris Hemsworth. He was at my house. We were the best mates. And I'm like, where did that come from?
Yeah, see?
Where did that come from? But then I thought back and I thought, I heard a lady say something about how nice he was on television. So that little thought must have been in my head and made me dream that. So I don't know, but yeah, it was a good dream. But
No doubt.
I get dreams about women sometimes. It was like, don't go there. I come. It's like, where'd you go?
the worst part is when you wake up from a good dream.
Yeah, it's like, and then you try to get back into that dream,
can't.
but you
No,
can't.
I can't go
It's
back.
too late. So there's no explanation where it comes from. Wow,
I think it's just your mind.
the mind's so complex. What about sleeping? Is it true that we actually, when we sleep, it's like we're in the body's kind of dead, or no? I've heard that online.
No, it's not kind of dead.
Really?
No, you've got different stages of sleep. You've got your REM
What are the
sleep,
stages of it?
your deep sleep. I'm not a sleep expert, but
Isn't there like
REM?
3 or 4 stages of sleep?
Yeah.
Yeah.
The REM is
I'm not
where
an expert.
people rapid eye movements. They're moving their eyes a lot when they're in REM sleep. So I think that's more superficial. So sometimes you can watch somebody and tell it what stage of sleep they're in. And some of these new watches will tell you. I remember I had
Apple Watch.
one. The
Yeah.
Fitbit actually will tell you how much you had I'd go and look, and I always had very little deep sleep. You want to have lots of deep sleep. So there are different stages of it.
I think all our sleeping is pretty shit these days. With technology, it's so bad. Sometimes I talk about myself. I'm on the screen for so much before I sleep.
Really
my
bad.
eyes are burning.
It's the worst thing to do before sleep.
They're screaming. They're like, just let me sleep.
And they say that the worst is screens before bed, but I think pretty much everyone does it.
We're all addicted.
If I'm on my phone, I'm watching TV. So it's.
So I remember listening to the radio once, and there was a study that came out, and this just goes to show how regressive our society's gotten to in terms of technology and phone use. They're actually saying that young teenagers, like 13 and 14, it actually helped them sleep because it allowed them to relax and get down their stress hormones and get them to sort of, de-stress after a big day, that it actually helped them sleep. So imagine how poor their sleep would have been for them to then go, oh, actually, here's a phone, work on your tablet, go on your screen to then help you sleep.
That's crazy.
I know, that's how bad things are out there.
We're using, who was it? Was the last episode or the one before where they said we can't focus? We've gone from 12%.
I was going to say that the
8%.
studies have shown that young people in particular have lost focus because they're watching a lot of the quick videos. TikToks are the worst.
Wow.
If you're going to watch a video, don't watch quick.
No TikToks, ladies and gentlemen, out there.
All those quick videos are really bad for the brain, and young people just can't focus. They can't stay on something more than a few minutes, and that's.
You probably find that in their lecturing as well, because I
100%.
absolutely do.
And
absolutely.
they don't, like, we used to have 1 hour lectures in the olden days.
Oh, yeah.
Now we're told, they shouldn't have, you should do little short lectures, 10 minutes each, because that's all they can deal with.
See, my excuse to that is I had a student say, oh, Boris, your lectures are 45 minutes long, they're too long. And I said, okay, well, what's wrong with pushing pause and walking away and coming back to it? Why do I have to then clip that into little segments?
If it's an online, of course, they can pause it, yeah.
Yeah, absolutely. And she was like, no, I can't do that. Can you just like cut it in for me? I was like, no, I'm not doing that for you. I'm going to record 45 minutes.
I've never had a student complain about my lectures are too long because I have fun lectures. I make a fool of myself in lectures.
Shots at you, Boris. Those shots fired.
Yeah,
no.
You should be more exciting.
Too boring.
I'm just saying,
There's no good content.
I use a lot of hand gestures in my lectures, whatever, and it's really cool because when I have an oral examination with a student and they suddenly do a hand gesture just like me, I think, oh my God, they've listened to me,
they've learned something useful.
Can the brain heal itself from like a really bad injury? What are the processes? Is it like, I had a mate of mine that had a really bad car accident. One died and one survived, and he kind of hit his head on the side door.
Yeah.
Now he's got problems with speech and memory. Would he eventually come back to how he was, or it's impossible?
I don't think he will.
Wow.
It depends on. I mean, the fact that he's obviously gone through the layers and
it's been 6 years now
to the brain.
Wow.
and still has problems with like speech and. So once it's damaged, it's pretty much damaged.
But he can speak. He's just got problems.
Yeah, it's like slow and it's a bit different.
Has there been improvements over the last 6 years?
Very little.
Yeah.
Probably about 5%.
My understanding is that there is some improvement and some other regions of the brain can take up tasks like, the bordering areas. But that's a very slow transition.
They call it neuroplasticity.
Yeah.
Can you tell me about that?
I don't know that much about it, but it just means that,
it's like a rewire of the brain, isn't it?
So some parts can rewire.
Yeah. He's been learning a lot from other guests.
Yeah.
He's getting.
Yeah, it's like tricking the brain into thinking other stuff. Yeah.
Your IQ's going up. You got to get good guests.
Yeah. We've been getting some interesting guests on, but
lots of spiritual people as well that speak about how you can use the brain and your emotional state to heal the body. Just from your own thoughts and processes and things. I mean,
a big believer that you've got to believe something for it to happen. Like, do you know what I mean? Like
manifesting.
Yeah. I mean, I know somebody who just won't take pills because they've convinced themselves that pills are always bad. They're never going to help them. And no, you can't have that. You've got to think the opposite for it to work.
So much of my culture's like that. They're like, I don't need the hard pills. I'm good.
Yeah. I mean, I think your brain can definitely have big control over what.
Yeah. Well, this goes back to when you were saying how powerful is the brain. Well, the brain has control over the whole body,
Your
right?
body.
And so any
You're-
region that's damaged can actually impact the rest of the
100%.
body, your thinking ability, speaking, movement.
Wow.
And the neuroplasticity, I think, is a really valuable part of the brain, a really good, I guess, physiological adaptation, because it just keeps you functioning better. And that's the beauty about the human body, is that it regenerates. And so you get an injury and it gets better to a point where you can still function. Maybe not perfectly, but at least you can get through your day-to-day and get on with most of the life stuff. And then, so with that neuroplasticity, I find it really interesting. And so I kind of like the idea of chronic pain and improving that. And that becomes a real big important part of it, is like, when you're in so much pain for a very long period of time, and chronic pain is defined of pain within 3 months, you actually get those neurological changes in the brain that just keep propagating that pain perception. And so to change that up, and then you can do it, it's a slow process, that's where that neuroplasticity comes into play, where you think you're better, you do movements, you reassure your body, and then you do actually improve the function of the brain and start reducing those regions of the brain that get fired up with that chronic
100%.
pain. So, you know,
That's crazy.
The brain is very powerful and it can re-heal itself and regenerate. But I guess the issue is like, when those neurons are dead, that's it, they're gone.
Yeah.
And what about how psychedelics affect the brain, or the new sort of therapies that we're seeing? I just read this one here. The psychedelics have shown promise as therapies against sort of depression and lots of other, mental illnesses as well. LSD.
Psychedelics, it's very interesting. Been talking to a lot of people about it. People that I know that have kind of tried it. I don't know. Everyone gives me a different explanation of it. Some people have been stuck in that trip, and they say it opens up some sort of parts of the brain, and I don't know. I think it's a scary place to experiment.
Hasn't a lot of great music been developed
Oh,
when
yeah.
people have been on LSD and all these
No,
psychedelics?
100%.
Yeah, all the music from the 70s. I mean.
But I'd say the same, but I think a lot of that stuff will kill your neurons, kill the nerve cells.
That's like pretty much drugs and alcohol and all that, intoxicants. How bad are they for the body? People that are listening out there and they're like, oh, I don't mind a couple of beers, but then they're really drinking.
I say a couple of beers is okay, but it's the excess.
That's when it gets crazy. 10, 15 beers a day.
What, a crazy like party vibe, or crazy as in like damage to the body?
Yeah,
liver,
damage to the body.
brain, neurons.
Everything. It's like, it's, I don't know, like, it's like someone that has a big party and then the next day you got, like, they're hungover. You can't talk to them, you can't even say hello to them, they just don't want to talk to anybody. What's going on inside the body? That fascinates me. It's like, has it shut down, or is it in repair mode, or,
It's in recovery mode, probably.
Wow. That's fascinating. Pain. What's happening to pain? For example, if I pinch Boris and he goes, ouch, what's going on? What's the process of pain? Is it like through, is it his skin, or is it?
Yeah, there's receptors that will take the skin. But I'm going to say this, females tolerate pain more than men do.
I 100%
have to
believe
say
that.
Do you believe? Thank you.
100% believe
I
that.
have to say
I
that.
mean,
Really?
Try giving birth, I'm pretty sure women suffer a lot through birth.
Oh, that's why men
wouldn't
haven't
understand.
invented birth, like if they can't birth, because you're never going to invent it, because you know that it's not going to happen.
Never thought of it like that. That's actually true.
Yeah.
The birth with sitting there and just screaming, it's serious pain. Wow, so you guys tolerate pain more than us.
Look, even something simple like tattoos. I remember talking to my tattoo guy, and he said that he sees the guys are the ones that faint and whatever. He said, not the girls.
So
He said
would
the
you
girls are
say
usually quite
would you
tolerant.
say that between men and females, this has always really been interesting, because I heard this like years ago. Is there the different types of pain is better tolerated by women compared to men? So let me explain. So I was told that women deal better with internal pain, so headaches, organ type pain, visceral pain, that sort of thing. And women don't tolerate so well when they have external, like arm pain, musculoskeletal kind of pain, like they fall apart. Whereas with with men, they don't tolerate headaches as well, but they tolerate like broken ankles and sprained ligaments, and they're still up to, I'll be fine, I'll still keep walking. Whereas a woman in the same situation would fall apart.
Not sure that I.
Not sure you agree with that one? No, all right. That was just something that was told to me by this guy at the gym, and I was like, I always thought.
The guy in the gym is
The guy in the
probably
gym
not
told you
your
a story,
best.
How you know when you're 19 years old
I know,
and some 45-year-old tells you a story, you're like, man, that's legit.
I actually never ever thought about it. Like they can tolerate pain more than us.
Yeah.
And so with that, is there any neurological difference, like significant neurological differences between men and women?
I don't know if they've done studies on that. I reckon there'd probably be something out there, definitely.
Yeah, are we sort of saying different tracks or different
No,
sort
they
of
wouldn't
pain
have different tracks.
receptors?
The track's going to be the same. But yeah, it'd be interesting, actually. I'll look that up on PubMed. Whether they've studied... There's somebody who would have studied it, but...
No,
What about first-hand for you, the difference between girls and boys, you know, that you're teaching, you know, how they learn differently, girls and boys, men and women, you know?
I think, in my experience, the females tend to be a little bit more open to trying new stuff. But that's a generalisation, because I had one guy a few years ago who was crazy and did everything. He was wonderful, so it's a generalisation. But no, generally they're... And I do find in my teaching, mature age students are better than the young students.
100% agree with that one.
Okay, thank you. Because people think young people are really cool or whatever. No, they're not. Sorry. I always tell them, your parents are way cooler than you'll ever be. No, the mature age tend to be more open to trying things than the young ones. The young ones are very set in their ways. They just...
With the program that you teach into, like anatomy would form the foundational course of a lot of different health professionals.
Oh, 100%.
Do you find that there's a program, i.e., you know, a career pathway that students resonate better with anatomy than others? Like, let me explain. So in my program, I find that osteo students do so much better and resonate a lot better with the anatomy content than other students such as nurses and pharmacology students and those kind of things.
Yeah.
Do you find the same sort of correlation with yours?
Physiotherapy and medical students probably the best. In the past, I taught medical radiation science students. They were really good too.
Oh, that would have been good, yeah.
But no, I think the ones that are going to be doing stuff hands-on are a lot more open to it. But you get a bit of everything in every class. So,
of course. That's pretty much what got me into osteo, was just the human body, understanding anatomy. And I literally got HDs in all my anatomy physiology subjects.
Same.
And everything else, I was like, oh, I just got there.
Just barely across. Me too.
Across the line.
Me too.
That's crazy. How was your journey? What made you kick off and like, oh, I want to become a scientist? This is it. I want to study the brain, study the body.
Yeah, it wasn't that easy. I lived overseas for a few years and I started studying medicine over there. But it wasn't really for me. So when I moved back to Australia, my mother was very upset. I did not go for medicine. But for me it was, when I did medicine, I loved anatomy. That was it. I loved anatomy. So when I came back to Australia, I thought, I didn't know what to do. So I thought, I'll do something with anatomy. I'll do science. So I did a Bachelor of Science. Then I liked that, and I thought I liked the anatomy, so I thought, okay, I'll do honours with anatomy, and then next thing I knew I was doing PhD. So it almost happened by accident. It wasn't really a conscious decision.
Wow. And anatomy is pretty much the study of, for the people that are listening, study of the body. The
body.
Muscles,
Yep.
bones, everything?
Yep.
Wow. The brain.
Everything. Well, everything, yeah.
Wow.
Do you find that, this is what I always find really interesting, like anatomists sort of hold anatomy in like really high regard, but there's a lot of bleed over between the different disciplines. So like physiology sort of takes on board a little bit of the anatomy context, and then you've got biomechanics that also take that on. So even though you're sort of looking at anatomy, like everything's very much interrelated.
Oh, it all works together. I mean, that's what you tell students. Anatomy is structure, but function is physiology. You know, structure and function go together like this. They work together, and biomechanics is part of all that.
Absolutely.
So no, they need to understand that it's all, you know, it all works together. But I like teaching anatomy. I'm not so good at physiology. It wasn't one of my better subjects. I struggled with physiology. I found it so much harder, but no.
How much harder do you reckon?
For me it was, but I don't know how I got through, but I got through, so, yeah.
Well, there you go. And you're excelling in it at the moment. How did you go with your... Because this is one thing that I'm always really interested in, talking to people that have completed PhDs, only because I'm thinking maybe in embarking a journey such as that. in your opinion, is it worthwhile, not worthwhile? Oh, she's shaking her head. She's like,
I would
Claudia's
sincerely
like,
say it's not worthwhile.
Not worthwhile? If that's what everyone's saying.
I don't feel that it has gotten me anywhere higher than yeah.
But if we're kind of saying, and if we're sort of saying that, how do we then get more people into research to do better knowledge?
I know.
How can we make the PhD process better?
Offer scholarships. I don't think we have enough of those.
Mm-hmm. Oh yeah,
Students need scholarships to do study. If it's 3-4 years.
Oh, it's a long time. How long did it take you to do
5
yours?
years. Took me 5 years.
Damn.
I was a slacker.
That's a big commitment.
I was having too much fun in between.
That's what you got to do when you're young.
That's it. It's so difficult that you need to.
So, could they make the PhD process easier? Like, do you have to achieve the same level of accolades to just know the content? So this is always what I struggle with.
Sydney Uni does, because in Sydney Uni, now I'm not 100% sure, but the medical degree now, it's a postgraduate degree, so you have to have a degree before you go in, but that they do 2 years of medicine, then they can do a PhD in between, which is only, I think only 2 years, then they do the other 2 years of medicine.
Yeah, right.
So they get a PhD out of it by doing a bit extra, so it's not as big as I'm not sure how that works, but that's the only one I know of.
That's
but
actually,
usually it's quite
that's
appealing, isn't it?
That's very appealing. I was thinking the same thing.
But yeah, it's
Having the skull there. Can you explain some things to me about the skull? I want to talk about this part here. So obviously the skull is split, the brain's split into two.
yeah.
The left and the right. What's the left used for and the right used for?
Oh, you've got different areas in there. So I think I'm trying to remember now. One of them is the arty one, and one of them is the logical one. I'm trying to remember which is which now.
Is it the left is the logical and
Left
the
could be
right
the
is
logical. Yeah, I thought it was the left is the arty one, but yeah,
Maybe.
you're just different areas in there. But you know what's really fascinating about the brain? I love showing this to students. This isn't a brain, this is a head. But when you look at the brain, it's got big areas in it. So this area here, the frontal lobe, is really big. You can lose a chunk of that and you'll be okay.
Wow.
You lose a millimetre of your medulla oblongata, which goes through here, and you're dead, which is how people died in hangings.
Wow.
People
Really?
People didn't. People think that people died in hangings because they couldn't breathe.
Yeah.
Yes, but no, they died in hangings because the little bone, the axis would have a little bone called the dentoid process, which would go backwards and it would go into the brain and cut off the parts of your brain which make you breathe and make your heart beat.
That little bone.
And it was literally a few millimetres. But this part of the brain, the frontal lobe, you can lose a big chunk. And there's a really famous story that I told my students about a guy called Phineas Gage, who was
Can you open up that, Davey, please?
Phineas Gage. He was a worker on the railroads, I don't know, 1800s, I think. And he was supposed to, you know, when they put dynamite in the ground and they cover it with sand and they hit it with a bar, that was his job. He put dynamite in. He forgot to put the sand in. He hit it with the bar. The bar went through his head.
Yeah,
there he is, Phineas Gage. You can actually go and see his skull in a museum in America, which I still want to do. It's on my bucket list. And the thing is, he lost a huge chunk of his frontal lobe, and that became a really important case for psychology, because they discovered that he lost that big chunk of brain. And what happened to him? His personality changed. So he'd do weird things. And there have been cases like that ever since that I've heard of. There was a CEO in America, like recently, who had a spear gun go through his head. Same thing, CEO of a company. And he seemed fine. And then he was in a meeting with the whole board, you know, one day. And in the middle of a meeting, he just stood up and went to the corner and did a wee. Now, that's just a personality thing. That's, to me, is amazing that you can lose a whole chunk of that and you're okay, relatively okay, but you use 2 millimetres of your medulla oblongata and you're dead, because that's a part that makes you breathe and heartbeat. So different parts of the brain have different importances. Over here, you've got the brain that's got to do with your ears, your hearing. At the back, you've got the bit of brain that has to do with vision.
So the vision's at the back?
At the back. So depending on what part of the brain you've damaged, you could damage different parts of you.
Front is for thought process and thinking?
Thought and personality. And then the part that I love the most is really deep. It's called the limbic system. It goes around. And I love the limbic system because the limbic system is the part that's in charge of emotions and passions and all the stuff that I love. So my friends always tell me, Claudia, you're so limbic. And I take that as a compliment. But different parts of the brain do different things. So to me, the fact that you can lose a chunk and you're okay.
That's
and
crazy.
you think of the frontal lobotomies. That's what it was about. You know, people would lose a chunk.
Yeah.
And they're
That's
still
crazy.
okay.
You've always thought my whole life, when you know, obviously you see someone getting hanged, he was just out of oxygen, he's gone.
No,
But
it's because the bone is breaking into the brain, which is affecting the part that makes you breathe and makes your heart beat.
Whoa.
So that's
That's
I always
intense.
teach my students.
That's crazy.
And
You will never forget that.
You'll never forget it. And it was crazy because I used to show my students, they used to have tables. They'd have a table with the weight of a person and how long the rope had to be so that you'd get that break in the right. They wanted to break the bone to make that happen. It was very technical. It was a terrible thing we used to do.
That's why it was
hanging
a
people.
profession back in those eras.
It was, wasn't it?
That's crazy.
It's crazy.
And then you would lose.
And you know what? That's all anatomy. It's all your anatomy. But then you know that really delicate part is more hidden. So the more
You don't see it.
yeah, it's like your arteries in your body. Your arteries are really hidden. Like I've got a girl arteries. You've probably got boy arteries where you can see them popping out. You can see your veins because they're not as dangerous, but your arteries have to be really deep because if you cut your artery, you could die.
That's
You know,
like, that's
but
when
if you cut a vein, you're probably not going to die. So they're more
Better protection.
accessible. And so the really important stuff in the body is really deep,
really
hidden.
deep. So we got
Supposed to be
pretty much arteries
everywhere.
here, the neck. There's one here, I forgot what it's
Everywhere.
called, it's a main one.
Carotid.
No, jugular.
Jugular is the
Yeah.
It's a
vein.
vein.
How important is that one?
Really important. So when we used to embalm bodies in Queensland, that's where you go in. You've got a huge jugular vein, a huge carotid artery. So you go into the bodies through there, you put a needle in, you basically remove all the blood through the jugular vein, and then you put the embalming fluid in through the artery.
Wow.
So you basically
That's
Because I've
replace.
seen that in the
That's very
hospital where
cool.
someone was going through treatment. They went through the neck and they did a surgery through the neck, through
Yep. Yep.
the actual vein.
Because they're really huge.
Yeah, I was like,
And the other, you know that when they do a heart bypass, my dad had one, they go in through the artery in here.
Through the
Your
femoral
artery.
Yeah.
That's where they go up to the heart.
wow.
Yeah, that's crazy, isn't
I
it?
just find that surgery
Isn't it?
so fascinating.
It's amazing.
Because I'm always thinking, how do they get that
Can you
fine
explain that?
filaments and wires going all the way through the...
So is it an art? Can we open it up?
It's an artery, femoral artery. Yeah, it's a femoral artery in front of your thigh here.
Yep.
It goes all the, but that's how they get in to do a bypass. My dad had 5 bypasses, and that's how they did it. It's crazy.
Wow.
You need
Yeah.
I remember my
see,
father.
yeah, that artery at the front.
Yeah, and then it goes all the way up in... Is
Yeah.
it the...
It goes up into the internal iliac arteries,
The
the common
aortas.
iliac, and then the aorta.
Yeah.
The aorta is so big; it's that giant artery on the back. That's why if somebody gets a bullet through there and it hits the aorta, you're a
Gone.
goner. You're a goner.
Dead.
Gone.
Yeah.
Yeah.
It's the arteries, the aorta at the back is so big.
And speaking of that, from a perspective of like palpation, you can actually feel someone's pulse through the abdomen
Yeah.
if you dig deep enough.
Really?
And if, yeah.
If they're not padded like.
Yeah,
me.
well, you know.
But
That's
you
a-
can.
yeah,
You know, a thin person, yeah. It's
Wow.
crazy.
I'm lost for words.
I always tell my students they should, by the end of they do an anatomy course, they should be able to take the pulse from about 20 different places all over the body. Everyone does it from here, but there's all these other
Where are some
places you
spots?
can.
So there's here.
Here, anatomical snuff box. Take it in the brachial up here. You can take it down there. You can take it on your foot.
In the popliteal
Dorsal of the
fossa. Dorsal of the
Popliteal
foot,
fossa
yeah.
behind your knee. There's so many places you can take a pulse.
Neck is the main one.
Neck.
Yeah, neck
yeah.
as well. Yeah.
Wow.
There's heaps of places. It's
This blew my mind because I remember my father. They opened up
yeah.
a clogged.
Yeah.
Because he had a heart attack and they
They
went
would
through
do,
there.
yeah, that's what they do. They go through the femoral.
And that's around the testicle area.
Yeah.
Yeah.
It's not that close, but yeah, it's
Yeah, well,
in the region.
I was just like,
in the region.
It's in the
kind of.
region. It's in the hip flexor, in the groin. Like
That's
you got that
crazy.
femoral
And then-
triangle. That's
And then there's a superficial vein going all the way up from your foot, all the way up to there. That they, for my father, they removed that whole vein, and that's what they used to make the bypasses in the heart.
What?
Yeah.
They
Yeah.
removed that?
Yeah, you can live without that. Yeah,
Would that be the same
There's
thing
things you can
that
lose.
they remove for varicose veins as well?
yeah probably.
Yeah. So there's a lot of stuff that
There's stuff
happens
you
medically.
can stuff you can move around, other stuff you can't.
That's like kidneys, pretty much. You can survive on
I survive on one
can,
kidney.
Yeah, you can
Donate the
you
other.
Does
Donate
that
donate a
affect the
kidney.
body though somehow? Surely it does. Living just on one kidney. What are the effects of that?
You can live on a kidney if
You
you're
won't have
healthy.
any bad effects on the body? Wow.
Otherwise, people wouldn't donate them.
Stop to donate a kidney. How much are they going for these days, Davey?
More expensive.
I think that's illegal in
You wake up
Australia.
in a-
I think it is.
If you wake up in a bath full of ice, you'll know it's already
Yeah,
done.
if you wake.
That's
Yeah,
fascinating.
no,
My
it's-
mind's blown.
Yeah, yeah.
The body's like. I'll put that post up today and I was just looking at it, I'm just like, holy shit. You got all these names and nervous systems and it's like, it's never ending.
Yeah, I think anatomists just generally like to just name things after themselves, probably.
That's what I absolutely despise, and we are trying to get rid of that. So there's a lot of names, and clinical people still use them. So I tell my students, okay, if you hear that, that's what they mean, but we don't call it fallopian tube anymore. We call it uterine tube. You know, there's a heap of things in the body where
Oh, right. I did not know that.
Men have named them after themselves. I say
Yeah.
men because they're all men.
Wow.
Yeah, well, that wouldn't surprise me because when you look at all anatomy books from the past, they're all male
they're all
anatomy
male.
mostly, right?
And I tell my students, when you open an anatomy book and you read the stuff, remember, it's not covering everybody. It's usually talking about a white Anglo-Saxon male. When you read that the femur is 50 centimetres long, that's in a white Anglo-Saxon male. It's not in me. Mine's a lot shorter. Do you know what I mean? Like, it's what
Do you think
what we're
that's
taught.
slowly, like now that
It's
that's a
like-
bit more prominent, is that slowly changing the textbooks and the language that we're using both clinically and obviously at university and academically?
Very slowly. There's still
Yeah.
a lot of people using, people still talk about the Krebs cycle and all that stuff. But
Yeah,
it's
of
not going to
course.
change.
And on that topic, did you, when you were 35 years ago getting into this field,
Yeah.
was that a bit of a challenge as well? Like, because it would have been mostly a male-dominated field, trying to go into those PhDs and go in academia and trying to, forge a pathway forwards.
Probably not so much in my
wasn't
area,
it?
in anatomy, but probably because my supervisor was a female, so I was lucky.
Good. Oh, there you go.
But yeah, no, not so much. I think there are areas though where it's pretty bad.
Possibly. I just wanted to know if there was any sort of biases, because I haven't really experienced any, but then again, I am a male, I guess.
It's incredible, man. It's blown my mind. Like, I'm sitting here thinking to myself, all these arteries and cords and everything makes sense. Like, it's all connected perfectly. And it's just like,
It's not all perfect though, but there are a few. Yeah, most of it is.
wow. What about, like, for example, it fascinates me a lot, like, if you cut yourself and
Yeah.
it starts to heal, what is the process of that? Is that the brain healing? Is it the body, the muscles? What is it? Like, you cut yourself and then all of a sudden, like 2 weeks later, it's healed.
It'll heal by itself. Yeah, I don't think the brain needs to do that. Yeah, the skin will start to close off, and it's all the cells. They just go into.
It's so incredible, man.
The human body.
The human
That is pretty
body,
cool.
it just, oh.
I remember when I was a student studying bruises, and when you study bruises at uni, you go through all the phases of the colours. They're black and they're blue, and I was fascinated by that. I was like crazy. That's just the cells.
What is a bruise? Like, say, for example, I hit myself and there's a bruise there.
You've made it bleed. You've made something bleed.
Bleed?
Yeah, I've made it bleed. But then the colour change it was remarkable because the colour change is showing you how it's healing. It just slowly heals. Or even a bone healing is crazy. So we
Holy
had
crap.
a bone at a university I worked at that had somebody died when they had fractured it. So this bone had a big lump in it where it was healing. So when a bone heals, it has a lump first that then gets down to the normal size again. But this person died when their bone was healing and it had this big lump. It was crazy to see.
Do you remember which bone it was? Was it the femur?
It was a humerus.
Oh, humerus.
Yeah, it was really
Wow.
cool. Yeah.
Wow.
It's
Can
probably,
we look
it's
at
probably
the
still
stages
there.
of
That is pretty interesting.
stages of bruising?
Stages of bruising.
Just
Yeah,
the pictures.
I'm
I just remember.
blown.
I just remember seeing the black, the purple,
Yeah.
and for some reason that I just
That
thought
blows
that
my
was
And
mind.
correct me if,
It was
if I'm
really-
wrong, but that's kind of the red blood cells
Yeah.
changing
Yeah.
and being broken
Wow.
down.
Go to the first one. Oh,
You want to see the skin, yeah. No, that doesn't look real, does it? You want to see a person with just the different colours.
That's
But
incredible.
you know when you get a bruise.
Yeah.
It starts off black, doesn't it?
Yeah, it starts
Then
off
it
real
goes
dark and
purple.
black,
Dark.
and then it
And that's
becomes
blood.
a bit more purple.
No, it's just changing. Yeah, just
I can't
changing.
believe I never thought it was blood. I thought it was just like,
What did you think it was?
just Tissue? I don't know.
Yeah,
No
that's a good
idea. That's crazy.
After you get punched in the face, you're bleeding in the inside of your face. That's what's happening.
Basically.
Your face is bleeding because you're getting punched.
Basically. But you're going to get the same response if you rupture a ligament or you have a sprain or a strain. It's the same sort of process. Generally speaking, like healing times sort of take minimum of 2 weeks, but then for all of that callus to form as well as the remodeling can take up to 8 weeks.
Yeah.
It's an absolutely amazing physiological process that you're going to get a lot of different mediators and different hormones that are going to be doing most of that work. So it's
so fascinating.
I just love it. That's
It's
kind
like
of the beauty about the human
you break
body.
your ankle and then all of a sudden you're in a cast and then the bone, it's just healing itself. Diego, you experienced that yourself
Yeah,
recently?
but he didn't stop. He didn't stop to let it heal. But
Oh,
it's healed
there you
itself.
go.
It's healed itself. It's because he's so active.
Yeah.
He didn't stop to let it heal, but it's just healed itself
Yeah.
through.
Well, with that whole immobilization side of things, there's two different schools of thought. Like, if it's a really bad fracture or something, then you mobilize until you get most of the repairing to occur. But then you got to load tissue so that you provide that stimulus for it to heal properly
Which I
and
think
build
is
up
what
the
he's done.
capacity.
Yeah,
Yeah,
definitely.
absolutely. And
It's crazy.
functionality improves so much better after that.
It's just mind blowing, man. Like, what's like you can't like I can't even imagine it. Like the bone just healing itself. Like what's going on there? Is it like? Can you explain to me like what's going on exactly? Like I just don't.
The
seem to
cells, the bone cells have to reproduce new bone cells, and then they go in there, and then and it's kind of like they make it. Oh, I don't know how to describe it. They make a big cake, but then they have to cut it down to make it the
That's
right
a good way of
shape.
explaining
I'm
it.
just trying to
That's
think
a
of a
great way
way
to
to
explain
just,
it.
like you've just got this big lump, but then no, that's not the shape of the bone. So the cells themselves. So there are bone cells that produce bone, and there are bone cells that break down bone. So what's really cool about it? Do you know what's really cool about that? Astronauts.
Yeah.
When astronauts are in space, they have to do a lot of exercise because if they don't, the bone cells that break down bone will break down their bone and they'll come back really. So their muscles and their bones will get weaker in space.
Yeah,
So
and they
that's
also
why
get real puffy too,
You
'cause
have
there's
to be
no
really
gravity.
healthy because astronauts have to do a lot of activity because those bone cells are doing this, especially when they've got no gravity. So it's crazy.
Oh my god!
It's all the body.
I feel like a scientist, man. It's time to do a PhD.
Yeah, off you go.
You could
You can
start.
spend 5 years doing it. See where you end
It's
up.
going to take me another 15 years. That's crazy. So there's
That's
two
crazy.
sides to it. The ones that are breaking the bones and one that's repairing.
I guess a good way of looking at it, the body is like a very complex machine that has like this perfect balance, like yin and yang. So there's a lot of wear and tear that happens in the body. So a lot of things are broken down, but just as those elements or tissues are broken down, we've got enough cells to regenerate that broken down tissue. And you kind of keep this perfect equilibrium. Not until something disrupts that, like let's say you break a bone or you consume too many drugs or you do something that's unhealthy that alters that balance, or you go into space, that alters that
Or
balance.
even you just start getting older. As you get older,
Yeah.
the bone cells start to produce less bone, so you're more likely to get osteoporosis and things like that, and bone cells get broken down more. So there's so many things that aging affects as well.
Where does the age start to kind of, the body starts to kind of go down?
At 30.
I got a couple of months left before my body starts to go backwards.
Yeah, no, I don't think you can put an actual figure on. Different parts of the body are different, but I'd say, 40 onwards.
Wow. So we've got
She's
another
been
10 years of gym.
generous.
Diego, we've got another 10 years, man. We've got another 10 years. 10 years of wild lifting.
Yeah, I think you'll be okay. I think you'll be okay. Because as long as you're loading up bones, as long as you're training and building up muscle tissue, there's...
It'll be fine.
You're coming down from a lot higher peak, so you got a lot more time before things wear down. The issue really is, like, from more of a disease perspective, is like people that have never trained, people that have never put their body under any undue stress, and they don't have the capacity. So when they age, they just fall from a lower point and they fall down to the ground real hard. And that's when you get all the, the diseases that happen, the osteoporosis. the loss of or weakness in the muscles and the atrophy that happens through the muscles. You get the collagen, reduction and not formulating all of those collagen structures as well. And so the key message there is just got to stay active.
And I have seen really hot 70-year-old men because they're in shape, they've kept themselves.
I treat a whole bunch of them.
Do you
They're
know
fitter
what
than
I mean?
me. Yeah, 100%.
Yeah, that's what I mean. Like,
Yeah.
it's not necessarily an age thing. But
I know some older
looking
women
after
that
you.
lift heavier than me. They probably lift heavier than you.
Yeah.
Wow.
They're like super fit.
That's not hard.
I like yourself, Davey. That's incredible.
Yeah,
exercise is, as I continue and get older, I realise how important exercise is, man, for the body.
I wish more people realised that and started earlier. And you don't really need to do anything crazy. You just need to go for a walk, do some push-ups, do some squats, just, work those muscles and not sit on your butt for so long.
That's crazy. You know what fascinates me as well? How long the skull remains when we die. Obviously, they put it in the grave. It stays for how long in the grave before does it ever deteriorate, or does it just stay?
Oh my God. Do you know what I got to see a few years ago? I was very special. I got to go to the Body Farm in Sydney. Have you heard of the Body Farm?
No.
I'd love to know what that is.
Okay.
Yeah.
You know how you can donate your body to science when you die to be used in an anatomy lab?
Yeah.
These are people who donate their body to the Body Farm. And at the Body Farm, they basically they put the body into different bodies into different experiments to see how long it would take them to rot. So they put this body in water. How long is it going to take? This body, we're going to leave it in the sand. This body, we're going to make it explode to see what happens. They do all these tests on the bodies to see exactly what you're talking about.
Do you know any evidence about
It's
acid?
amazing.
Wow.
Oh, the stuff they do there is... I was fascinated by that place. It was unreal.
How was it in water? Did it rot pretty quickly?
Yeah.
Which one was the
Well,
fastest?
we were
out
only
of
there
all?
a day, but yeah, we got to see different stages, yeah.
Which one was like the fastest?
So we just got to see all these rotting bodies at different stages. It sounded gross, but it was fascinating, absolutely fascinating.
That's crazy.
I guess that's
So-
really important research and
100%,
knowledge to
because
know
when-
if you're doing forensics.
So
you gotta
I'd
sort of
love to
know.
donate my body to science, but if an anatomy lab can't take me, send me to the Body Farm, like.
So with that, I'm really fascinated by this because I'm sort of dabbling, what do I do with my body when the time comes? What is the process for signing up to donate your body to science? Is there
Okay.
like a website or
Well,
what is it?
I ran a body donor program in Queensland when I was the head of department up there. Yes, most universities that have anatomy labs will have a body donor program, and you basically sign up to them. So I think for
to a
Melbourne,
particular university.
Yeah, Melbourne,
Yeah,
it would
right.
be. I think Melbourne, it's the University of Melbourne. I think not every uni does it, and you basically sign their forms doing that. The problem with the bigger cities, which I find, is that they don't take all the bodies that are donated.
Only the best.
No,
Only the
they
best physical
usually
shape.
take no, not that at all. They usually take the ones that die between 9 to 5. Like, it gets to that point where they've got so many.
Oh, really?
Whereas when I worked in Queensland, we were a small university, small town. I took everybody, so I was answering the phone at 3 in the morning. I took everybody literally. So that was good because I didn't want to say no to anybody. But I know that in big cities, you might not be accepted. I mean, you might.
Yeah, right.
And then when I was living in Albury-Wodonga for a while, I had no hope there because I wasn't not close to any university. So you need to be close to a university that has these donation programs.
I find it fascinating that they hold cadavers in such high respect, and I love that about it because it is a human person that's donated their body for the purpose of education and science.
Students are very, very lucky.
Yeah,
to get
100%,
that.
real lucky, and I kind of love that. And there's like laws and ways you
We've
can
got
sort of
the-
handle those bodies.
Yeah, we've got
and
the Anatomy Act in every state.
that's what it is.
Yeah,
I
the
couldn't
Anatomy
remember the
Act.
name.
Unfortunately, they've got a different Anatomy Act in every state, which I've always... Australia's
Really?
crazy. We have different laws in every state. I don't know why. It should be one.
We do. Yeah.
So in Queensland, we were able to keep bodies for 8 years. In Victoria, I think it's 3 years. So there's a lot of
Alright, so
variation.
there's an actual expiry date.
Yeah.
What happens to those bodies afterwards?
You do whatever the person wanted. Most of them will ask for their remains to be returned to family or their ashes to be returned somewhere. Or we had a lady who wanted her ashes thrown under a rose bush in Queensland, so I drove around looking for a rose bush. It was really funny. I was trying. So, you know, it depends on what people want.
Yeah. But that's awesome of you to sort of handle 100%. Those bodies with that utmost respect.
Oh, you have to. And I love that job. It was one of my best jobs I've ever done. But I think it's a bit different in the bigger cities, how it's run. It's much more business-like, you know.
I just know it's an option. I just never really
I think, to me, the biggest thing that Australians need to listen to and they don't do enough is donate organs. Australia's got very, very bad rate of organ donation, and that, to me, is more important than anything because that saves lives.
It does, yeah.
There are countries, I think Spain is one of them, countries where everyone donates their organs unless they've said no. So all organs are taken when you die, unless you opt-out option.
Yeah.
I think that's a much better. We don't do that in Australia, and people die here waiting for organs. So I think that to me is sadder. I think anatomy labs we're fine. It's the organ donation.
Organs.
Yeah.
And so with that education and moving, well, as you've sort of mentioned, moving more online. Doing less work with cadavers, less with hands-on stuff, which I think it's not the right position or direction to head into. What sort of new technology is coming out to sort of bridge that gap? Do you know anything that's coming out?
Look, I know in Europe a lot of universities have gotten rid of cadavers for teaching, and they're using technology like apps on computers and things, which I personally think is horrendous. It's not the same at all. But that's what they're doing. They're doing the kind of, all the new technology. I'm trying to remember, augmented reality, all that virtual reality stuff.
Yeah, I've heard about that.
But it's not the same. I don't know what will happen over time, but I think a lot of laboratories are getting rid of cadavers all over the world because it's expensive to run.
Yeah, absolutely.
But definitely better for the students. So, I've found... And the other thing I didn't mention is with the stuff I do, I had a lot of people saying to me, the stuff you do, Claudia, is a bit crazy. You're not going to have your Muslim students wanting to do it or the Aboriginal students wanting to do it. No, that's not true. No. Every young person wants to do stuff that's fun.
Yeah,
and
absolutely.
they all get into it. So, some of the pictures I sent you, we had Muslim students body painting. They'll all do it.
So important. I'll show my sisters that stuff.
They want to. They want to. Young people want to do stuff. All people want to do stuff that's going to help them and that's interesting and that's fun.
And after all, anatomy is so interesting. Like
so important.
Everyone wants to know about their body, wants to know 100%. How things move and what things do.
Yeah.
Absolutely, at all ages.
And all you do is just find something that suits you. For the Muslim students, they had to find a body part that suited them. It was the arm, and that's fine. Paint your arm. That's it. You don't have to get your butts out like the Aussie kids were. So there was an osteo student, I remember. I couldn't get him to keep his pants on. It was just,
that's osteo.
He wanted everyone to paint his butt every week. It was good though. Like it was good that they got to that point. I mean, considering
for education.
When I got to Melbourne, I thought the Melbourne students were a little bit uptight, but I got them all, doing this stuff.
And that's Melbourne.
It is,
for you.
Well, Queensland they were great, but Melbourne, I got them all doing it here, so it was pretty good.
Recently what I came across as well was pretty fascinating. How much water there's in the body.
Yeah.
That's huge.
Isn't it 90%?
I could not believe it.
90%?
Can we check it, David?
I thought it was 90, but I'm probably...
I thought it was about 75.
I was exaggerating.
It is a lot, though.
It's a big...
It blew my mind away. It was like, the body...
That's a lot. No, it is.
So important.
It's a lot of water.
I was like, what? I thought it was always blood.
60. Really?
Well, there you go.
Oh, I've got more than 60. Sorry.
Water weight, right? I think you have.
Let's kick on that picture there. The brain has 75% water.
This is the percentage of water in each organ.
Wow. The bone system.
How is the blood 80% water? Okay, I suppose it is.
83.
Yeah, I suppose the cells, I suppose 83, yeah.
Well,
I just think as well.
So many people don't drink water. Like my mum has heart problems. Doctor keeps telling her, drink water. Yeah. Barely drinks any water. Coffee all day. All day. She never listens. She never listens. I had a family member from Sydney. He's got heart problems. He needs to take his medication. He's like, let me experiment and see if I don't need the pills anymore. Decides not to take them. Ends up having a heart attack the same day.
Oh, no.
It's like, what's wrong? It's
Why
pretty
would you
wild.
Experiment on that? That's crazy.
Yeah, he wants to experiment. He wants to see if I can, he can
beat
without
a heart attack.
Yeah.
Beat the medication requirements.
It's incredible, man. The body, man, it fascinates me. It's always constantly questions come into my mind, like, you know, the eyes, how like powerful the eyes are, like seeing stuff, like
I almost think you
colours.
need to enroll in a biomedical degree and
I just find it
find your
fascinating.
own.
Like it repairs itself. How a single small cell, if it gets clogged up in like an artery, you have a heart attack. It's like, it's so like, everything has to run like kind of smoothly. And if it doesn't,
Homeostasis.
yeah. And if it doesn't run, then you're in big troubles. It's actually wild. Even like the eyesight, like just seeing colour. I find these fascinating.
Hey, here's something that I don't know if is true. Someone said that the human eye, back to one of my little facts that probably isn't really a fact,
That you heard at the gym.
that I heard at the gym from some
Check you
guy.
as you say it.
Yeah. That we actually can't see the colour colour pink. That we actually can't see the colour pink. Like it
Really?
is a colour that we cannot see, or it's not been recognised by the receptors in the eye.
Claudia,
Like I could
what do
be
you reckon
wrong.
about this?
You're wrong.
I'm wrong.
Wow.
I can see the colour pink.
Yeah, but so my understanding is like you can see it, but it's not because the waveform of pink resonates with the color in the eye. It's something that you
Oh, yeah, it says
kind of
it here.
recreate.
Pink is
in
something
your
brain
mindset.
invents when
Yeah.
it encounters a gap between red and blue wavelengths.
There you
So
go.
Wow.
Which is the red
So
and
you're
blue.
not-
It's
so
red,
pink
blue, and
doesn't
green.
Yeah, so pink doesn't exist, but
But
you see it because your brain makes
If I
it happen.
see it, it exists. I'm
Oh,
sorry.
there you go. Seeing is believing.
Seeing is believing. I'm sorry. That's
crazy.
the scientist side of me. Yeah, no, that's cool, isn't it?
The
That is
eyesight,
really cool.
man. Pink. So
Well, that's you're talking about your spectrums, you know, the blue, all that. That's fascinating. And that's what I did for my honours and my PhD is the cells in the retina. So you've got different...
retina? What's
yeah,
that?
the retina is the layer that sits in your eye that you see with.
wow.
That was 6 years of my life, retina. Yeah.
Just studying that.
Yeah.
That's a PhD for you.
It's a PhD.
That's a PhD. You study
Honours
one
and
thing
PhD, yeah.
for 6 years
Yeah.
to get a PhD title so you can be called Dr. Claudia.
No, I don't. No, nobody calls me that. I have sometimes students, usually the international students call me professor. I said, don't
Oh,
call me that. Just
no.
call me Claudia, please. So, but
Professor.
then I know that there are lecturers who want to be called doctor. So I'm like, no,
Oh, yeah,
not
they're
me.
the lectures you don't really want.
No, to me, I treat my students like we're the same. I've never treated them like I'm better than them. Never, never. I always and that's why I set up a good rapport with them. We get on really well. You know, it's important, I think.
Something that I always wanted to know as well. When we cry, these tears, where are they coming from? I find it very
From
interesting.
your lacrimal glands, you've got two glands here on either side.
Yeah.
Those lacrimal glands produce tears. They go on the front of your eye and then they come out a little tube. What happens when you cry? It comes out your nose. The tube comes out inside your nose.
Wow.
But that's normal tears. But if you cry too much, the tears fall out the front of your face.
You cry because you're a big
Okay.
baby.
Yeah.
That's why.
But that's it. So that's how the tears that
Wow.
produce here, they go onto the front of your eye, they go down, creep into your nose. If you cry too much, they fall out the front of your face.
And so is this where the limbic system comes into play?
Yeah,
Makes
probably.
you emotional and makes
Yeah.
you start crying like a
Wow.
big baby?
Oh, I don't cry much. I'm strong,
well,
man.
isn't it cool though? What I find fascinating is that when you can cry from laughter. I love that.
Yes.
I love it when you
Yeah.
can cry because you laugh so hard.
And that's the same process as
Yeah.
well.
Or when I was teaching my daughter one day, I said, "Why do you think we say belly laugh?" Because a belly laugh is because when you're breathing out. When I teach respiration to my students, when you breathe out, you're using your abdominal muscles. So that's why we say belly laugh, because when you laugh hard, your belly actually aches. So
It does.
that's all
Wow.
anatomy. That's all your body.
And then I'm looking at someone, I'm just saying, no more, the pain, stop. You know? And we're just in tears. So that's two different types. So you've obviously got heartbreak, where grief, and then you start crying. Or is it just the same tears?
Same tears.
Wow.
And they're the same tears that you've got on the front of your eye all day because they have to keep your eye moist. Your eye needs to be moist all the time. Otherwise, your eyelids would be like sandpaper.
That's why we
They're
blink.
not.
That's why we blink, right?
Yeah. But that's it. Can you see it? Can you feel that? Like
Yeah.
it's smooth because of the tears. The tears are keeping it moist.
Wow. So I've got to cry more often then
If you get dry
to get
eyes.
more
Does he?
fluids in
Cries all
there.
the time on the podcast.
No, hey, watch yourself.
That's his
Dave.
excuse. That's his excuse. Oh, I'm keeping my eyeballs like,
yeah.
moist and
Fascinating how
lubricated.
it just blows my mind. You know, even sometimes you'll be sitting there and you're just and then your eye gets so dry. Is that because all the fluids have pretty much dried up because of the rubbing?
Yeah.
You're dehydrated as well, right? I guess if you're dehydrated, you'll...
Yeah.
You know what I'm talking about, Boris?
Yeah.
You're sitting there, you just
Absolutely. I wear
Well, if you
contacts,
rub
so
your eyes,
I know
yeah.
exactly what you're talking
Yeah.
about. I get dry eyes probably more than most.
Wow.
And I'm always like, ugh. And also when you're tired, you're like rubbing those eyes. Kind of feels good sometimes too.
does. It's very different. The body, man. I would say we're engineers. Don't you reckon, Claudia? Do you reckon the body's an engineer?
Body's amazing. I love it. So I was just going to tell you that all the work I've done, all that body painting stuff, I've actually done it, shown it off at an art exhibition I ran in Albury, and I'm actually hoping to run that art exhibition here in Melbourne. So if I do, I'll let you know.
Yeah.
Yeah, my
The
photos.
photos of all of it?
Some of the photos are lifelong. Like they've made
awesome.
them, you know, the big things that pull
Yeah.
out. They're life size.
So you've almost
Pictures.
created like your own
Yep.
exhibition like they usually
Yep.
do with that
That's what
body
I've
where they
done.
take
Yep.
those slices of the body.
Yep,
That's
awesome.
awesome.
So I'm going to do an art exhibition here in Melbourne. So I'll let you know if I do that. You can come along and have a look.
Oh,
Yeah,
100%.
absolutely. We'll get
Bloody
check it
hell. Load up the car and go Boris and Davey and
Yeah.
check it out. And Diego in the back somewhere.
Well, Diego wants me to body paint him, but it's not that easy because I don't have the artists. My artists were all from Melbourne, but they've all gone on and done careers, so I don't know if they want to come back and...
Time to pay. Diego,
paint him
I've got the
also.
body for it.
Yeah.
Can I paint myself?
No! You can touch yourself but not paint yourself. Doesn't work painting
They'll
yourself.
That's
no, it
wild.
doesn't.
Do that for free.
Yeah.
You can do that for free.
I want to touch on the last thing as well. It's, I don't know if you would have the answer for it, but for example, if I'm walking down the road and I find someone and I find her attractive and you kind of fall in love with her. Not a
Love at first sight.
Why do we get this feeling in our stomach? It's always in the stomach first. It's like butterflies. What is that?
It's the limbic system.
Wow. And that's triggering to the body? Feels like butterflies. It feels like you're over
I
the
know,
moon.
it's true. Ignore it. It's bullshit. Sorry.
See?
Wow.
Love is
You know.
bullshit.
Ahmed falls in love with everybody he meets.
I'm sorry.
Every woman he
This
sees
is
in the
a-
shop, he falls in
This is
love
coming
with.
from a lady who's been married twice. So,
Love is
no,
bullshit. See,
no,
Davey?
but that is the love at first sight. It is kind of amazing, but that's what it
Absolutely.
is.
Yeah.
It's
just-
fascinating. It's like all of a sudden your
it's-
heart's racing.
It's totally, yeah.
But also on the converse part of
Yeah.
that is like when you get your heart broken, right?
Ah.
That's
Oh, you
considered
feel it.
more painful than
Yeah,
someone breaking a
100%.
bone. Like everyone's like, oh, I'd much rather break a bone than have my heart break.
Yeah, pain.
Because and it registers in the same parts of the brain apparently.
I feel like it leaves a permanent effect on your heart. There's no doubt.
What?
A heartbreak.
No, heartbreak on
Yeah.
the heart physically or in the brain?
It's
in the
your
limbic
limbic
system.
system.
It's a brain.
Yeah, it's your
Wow.
brain.
It just stays stored, never
Yeah.
goes away. You know, you turn around 20 years later, it's like, bastard broke my heart.
Yeah,
Still remember,
yeah.
I still remember my first girlfriend when I was 16. She cheated on me.
Wow.
Oh, no,
See?
sorry, Dave. It's still
16.
heartbroken.
Broke my heart.
And
cheated
you'll
on me,
never
left me
forget
for this guy called Steve.
Steve.
He still remembers.
remembers it.
That's
In high
crazy.
school, she was
Wow.
my first girlfriend, like first long term, girlfriend, and we went on a trip to.
How long was long term back then?
A year, like just
Okay.
over a year.
Oh, that is a long
That is a
term.
long term for
Yeah, it was
For
a long
16.
time. I think it was like 15 to 16.
Yeah.
Around that. We went on a school trip to France, and she didn't go. So I went with the school, and she stayed in at school with this other guy was there. And I came back, and the guy was my friend said, "Oh, you still together?" I was like, "Yeah, I think so." And they were like, "Well, we just seen your girlfriend holding hands with Steve."
Oh
my god! Broke
Well,
Broke your heart.
let's hope
I'm so
they're
sorry for your heartbreak. Dave.
let's hope they're listening and they know that they broke your heart.
Yeah.
Still
Because no,
listening to
but
you.
you're right.
Suffers.
That's all. It's you feel it.
It's so
physiologically.
powerful. Yeah,
you feel all
it's
that.
incredible.
Yeah.
I find
Never
that very
forget.
fascinating.
Feelings are powerful.
Emotions and feelings.
Yeah, emotions. Yeah.
Oh,
The body definitely holds the score for everything that you do. Heartbreak, chronic pain, issues.
oh yeah, never
Functional
ending chronic
problems.
pain.
It's all
Mental
connected.
pain.
Mental pain, the stress, the anxieties, all of that.
Even like stress, it's incredible. Like when you're really stressed, how your brain starts to really hurt. You get all these migraines, and is that like an overload in the brain? Is that pretty much the brain just overloading?
Probably. But some people do suffer from migraines anyway. So yeah.
Wow. Where does the migraine come from? Is there like a certain part of the brain?
No, it can be in different parts.
Wow.
I've never had one, so I just listen to other people. Yeah, yeah.
That's incredible, Claudia. Thank you so much for coming on, Boris.
Oh, that's okay.
Pleasure.
It's an absolute
It's a
pleasure. It was a crazy conversation.
We love talking anatomy, and it does go different directions.
I
doesn't
love it. I've learned so much today. I think I'm going to become a scientist. Ladies and gentlemen, no more podcasts. I'm going to become a scientist.
We think you should enroll in a Bachelor of Biomedical Science.
There you go. My sister's getting into that, so they're both getting into it actually. They love the anatomy, man. They're
That's
fascinated in it
So you
hard.
had 14 years
What?
with
Yes.
a real degree.
Yes. You will call
With a
me
PhD.
Professor Ahmad.
Professor.
Oh, he's going to make us
He's
call him.
good.
You're going to be one of
We'll be
those.
dead before that happens.
With the mustache. Oh, you know?
Tweed jacket.
Yeah, pretty jacked as well. But I appreciate you guys coming on. That was incredible. Learned so much. It's fascinating. Thank you so much
You're
for
welcome,
coming on.
Professor.
You are welcome.
I love it. Thank you. That was crazy.